Hi guys, hi everybody. First and foremost, thank you for having me at this event. I truly wish I could have joined you in person, but I have no doubt your event will be absolutely phenomenal. Precision Public Health, as you know, represents a transformative approach in modern healthcare, leveraging data, technology, and tailored interventions to enhance the accuracy of disease prevention and control efforts as well. Um, uh, Rigid guidelines usually stuck us between a rock and hard place because this usually can restrict a physician's ability to offer personalized care. Why? Because patients may have unique conditions or needs that require customized treatment plans outside these standards, just like complexity of condition, cost effectiveness, limited evidence, outstanding or outdated information, cultural incompatibility. So while guidelines in treatment can be useful for providing evidence-based recommendations for patients' care, there are also potential problems with following stiff guidelines. And as we see here, the first one is inflexibility. Second is lack of patient input and of patient-centered care. Why? Because following guidelines too rigidly can make patients feel left out in the cold, since their personal preferences, values, and family needs are discarded or ignored, leading to potential satisfaction with their care. Third one is unintended consequences. Unintended consequences can include the overuse or underuse of medications, adverse reactions, delayed recovery, ineffective treatment. Fourth one is legal issues. Guidelines actually for the physicians is like walking a tightrope. Why? Because yes, they can protect themselves legally, but strict adherence to legal issues may also expose them to liability if patients suffer from, for example, by following them too rigidly. So while following guidelines can provide some protection for physicians in legal cases, strict adherence can go lead to liability also. Uh, as we see here, precision medicine is a or transitioning from a one size fits all approach to personalized care. So it's never to say never. Again, it's never to say never. We have to come clean and confess that regular medicine practice is not appropriate anymore. We have to acknowledge that precision medicine is shifting from one size fits all approach to personalized care, tailoring treatments to individual patients' unique needs. It's something like what we call cutting to fit the clothes. Uh, as you see, as a nutshell, it's healthcare approach that aims to provide tailored or customized personalized treatment and care specifically to the patient, specifically designed for each patient individually. So, precision medicine is a healthcare approach that aims to provide tailored or customized personalized treatment and care to patients specifically designed for each patient individually, based on their individual characteristics, whatever is genetic makeup, lifestyle, environmental factors, medical history, or whatever. Uh, it's noteworthy to mention that precision medicine strives to tailor medical treatments and healthcare strategies to individual patients based on their genetics, environment, and lifestyle, ensuring uh, more effective and personalized care. Let's see here. So precision medicine strives to first to identify the right treatment for the right patient at the right time. Second, or second, it's the same, to tailor treatments to meet the needs of individual patient through customizing or personalization of therapeutic approaches by using personal information, highly specific diagnostics, and precision treatments. Starting from that point and from now on, and to the best of my ability, I will try to simplify the matters because actually they are in need of being simplified. Uh, to go on through the precision medicine, we have to know many issues. First of them is traits. What are the traits? Traits are observable characteristics or attributes of an organism, like phenotype. Phenotype is or either physical like skin color, eye color, color of hair, like weight, height. Physiological traits are the physiological processes and metabolic processes. Behavioral traits, developmental and disease-related traits. Genomes, genomes are the organism's entire set of DNA, including all its genes. Here, genomes is or are the structure of DNA. While epigenetics changes in gene activity, not structure. Okay? Transcription, the full set of RNA molecules transcribed from DNA of an organism. So it's the RNA coming out from DNA of each organism. Exposure is a complex environmental exposure that an individual experiences over his lifetime, whether such environmental exposure is physical, chemical, biological, or even psychological. Metabolism is a complete set of metabolites. Proteins is the entire set of proteins produced by a cell, tissue, or organism at a particular time or under specific condition. While microbiotics, as we described before in the last webinar, is the collection of microorganisms. Very simply, while the traits are characters, the omics are describing such characters by studying the traits. So omics is studying the traits. So from each name of each trait, we're gonna take its corresponding omic. So phenoms will be phenomics. So what's phenomics? Phenomics is studying the traits of physical, physiological, behavioral, and developmental disease and related traits. Genomics describes the trait which is named genomes. So genomics described by studying the organism's entire set of DNA, including all its genes. Epigenomics by studying the epigenomes, which is the changes in gene activity, not structure. Transcriptomics describes the trait named transcriptome. So it's studying the full set of RNA molecules transcribed from DNA of an organism. It focuses on understanding which genes are being expressed. I told you before which of them will be on or off. Exposomics coming from exposome, which is a corresponding trait. So exposomics by studying the complex environmental exposures an individual expert or experience over his lifetime. So exposomics describes the complex environmental exposures an individual experiences over his lifetime. Metabolomics describes the trait of metabolome, which is a complete set of metabolites. Proteomics, the entire set of proteins produced by a cell, tissue, or organism at a particular time under specific conditions. And lastly, microbiomics describe the trait of microbiome or microbiota. So microbiomes is an omic describing by studying the collection of microorganisms, which are bacteria, viruses, fungi, or whatever. Like pieces of puzzle coming together, the interaction of various traits with molecular signature and biomarkers creates a complex network of elements that collaborate to develop and implement personalized treatments for each individual. So we can simply say that the different omics of any person alongside with his molecular signature. What's molecular signature? Is a pattern or characteristics of gene expression. We call it genetic makeup or genetic sum. All the biomarkers that's associated with a particular disease or response to treatment, beside or side to side with his biomarkers, either diagnostic and prognostic. So, omics plus molecular signature plus biomarkers plus environment plus other characters forms what's known as complex network. A complex network or complex web or network different elements that work together to develop and implement personalized treatment for individuals. So the combination of omics plus molecular signature plus biomarkers of each person plus his environmental exposures, whatever is that exposure, forms what's known as complex network or web of different elements that work together to develop and implement his personalized or tailored treatment individually, which are specific for each person. The end result is tailored management. Here we're going to take a clinical case to prove or disprove the effectiveness of precision medicine. We speak about colon cancer treatment, which often, as you know, like any cancer, follows a standardized protocol where patients receive the same therapy regardless of individual differences in their biomarkers. This approach unfortunately assumes that all patients with similar stages of cancer will and should respond similarly to the treatment, which is a very wrong assumption. Because biomarkers such as genetic mutations or molecular characteristics can vary between patients, influencing how they respond to treatment. We know that. So if the biomarkers suggest difference potential for improvement, using a one-size-fits-all treatment will not be optimal for the treatment of all patients the same. Why? As it doesn't take into account these personalized factors that could affect the success of therapy. So tailoring treatment based on these individual biomarkers could lead to more effective and personalized care. So here we use another form of treatment, which is precise management or precise medicine or personalized medicine. Here we have many patients, 3 patients. Cancer patients with colon cancer receive personalized therapy based on each patient's specific characters, each patient's specific traits, biomarkers, and environmental exposure, and so on. So tailoring treatments based on these individual biomarkers could lead to more effective and personalized. Now we're going to speak about the probable benefits of using such approach, which is precision medicine, and take care. Till now, we speak nothing about the public health or precision public health. Till now, we are just only talking about precision medicine. So what is the first benefit of such approach? The first one is more comprehensive and detailed understanding of biological system. This type of approach gives us a chance to study the omics, the genetic makeup, and the biological markers of each person individually. So it leads to better understanding of the disease dynamics and progress with better understanding of diseases trends. Second, improve the diagnosis. It's improved disease detection, predict susceptibility to disease, something like predicting the risk factor of each disease. Preempt disease progression, the expected disease progression, and how to prevent the illness from starting in the first place. Third, more accurate prediction of and prescribing the most effective and safe treatments. And here is a very important point because it avoids prescribing drugs with predictable negative side effects. Definitely. Second, we reduce the time, cost, and failure rate of pharmaceutical clinical traits. Uh, Fifth point of the benefits of precision medicine is reducing the healthcare costs by preventing unnecessary tests, by preventing unnecessary procedures and treatments, by improving outcomes through personalized treatments. Number five is improved patient outcomes by survival rates. Improving survival rates have been increased with improving the quality of life and overall health. Number six enhances disease prevention by shifting the emphasis in medicine from reaction to prevention. And here is very important point. Again, I'm stressing about that point. Using the precision medicine approach has shifted the emphasis in medicine from reaction, I mean here by reaction treatment, from treatment to prevention and customizing disease prevention strategies. Number seven, it's more efficient clinical trials by identifying patients who are most likely to benefit from a particular treatment, leading to faster recruitment and more successful trials. Now, this is the perfect moment to delve into precision public health, which is a concept that springs out from a visionary framework of precision medicine. If we start speaking about the conventional public health, we can say that studies have mainly concentrated, I mean here, the studies of public health, usually concentrating on limited environmental stressors at the population level, which fail to capture the complexity and variability of individual environmental exposure. So, the third way to better understand how a person's environment can impact their traits, it's essential to combine detailed long-term tracking of environmental exposures, which we call it before exposome, with internal molecular data. So different effects on different people, I mean here the environmental exposure can have different effects on different people based on their different individual omics, molecular signature, and biomarkers. Again, to fix the information, different environmental exposure can affect persons differently, not in the same way, depending on individual omics, individual molecular signature, and individual biomarkers. Now, if we want to speak about how did the vision of or the approach of precision public health came out of the vision of precision medicine, let's start again from the start. Precision medicine using different omics, phenomics, genomics, transcriptomics, exposome, and so on to the end of omics. Okay, using such omics alongside with the biomarkers and with exposures and so on will lead to better, more personalized care of one person. This is a precision medicine. But applying such vision on population, actually the benefit will come out to every person in such population. So, by using the vision of precision medicine at a population level, using the population level health data and better risk stratification and understanding, definitely the those population who will get benefits will be a lot, not one only like in the precision medicine, but a lot of persons in the population. So it's quite essential that precise public health is a holistic approach using omics technologies such as genomics, proteomics, and so on, all the story we have discussed before, to improve public health outcomes, not a person, to improve public health outcomes with probability and scalability to add any discovered new high tech. So for now, we have been using the omics with the traits, with the biomarkers, with the genetic makeup. Maybe, or there may be scalability in the future to add any discovered new high tech in precision medicine. So, by analyzing such detailed molecular data alongside environmental and lifestyle factors, it allows this usually allows for more personalized and effective interventions, usually or accordingly helping to address the health issues with greater precision and reducing disparities across population. Now we can say that this shift from vision precision medicine to precision public health, this shift refers to the movement from traditional public health strategies, which often used broad, generalized approaches, to more personalized, data-driven methods. So by incorporating individual data such as genetics, lifestyle, and environmental factors, public health strategies can be tailored to better meet the specific needs of different population groups. This personalized approach, as we know now, allows for more effective interventions, improving health outcomes for communities as a whole, by targeting the root causes of health issues, not single causes. We call it root causes, which is more precisely and addressing the unique needs of diverse population. Now, I can freely say that an important precision public health is an important shift towards personalized and data-driven approaches to public health that can ultimately lead to better health outcomes for populations as a whole. Now here I am going to stress on exposure, which we call it by the language of omics, we call it exposomes. Exposomes are the traits. Exposomics, as I told you before, is the study of the trait of exposure. So, since we are speaking about public health, the exposomes here, exposomes is the trait, and exposomics by the omic language is studying of the different types of exposure. So now we are in need of something like risk assessment, uh, starting by hazard identification, then hazard quantitative and qualitative assessment, exposure assessment, risk characterization, and estimating the total risk. We call it as, or by the end, is a risk assessment. Let's start by what's hazard identification. Hazard identification is speaking about what can go wrong, what is happening. There's W missing here. Okay, sorry. So what can go wrong? What are the consequences of such exposure? I mean, what can go wrong is the exposure. What is the wrong exposure here? Is it heat, noise, radiation, polluted water, air pollution, or whatever? Second, what are the consequences of such a wrong exposure? And how could it arise? What are the triggers of such hazards? What are other contributing factors? How likely is it the hazard will occur? Okay, so second part, who? Who is the population that's most at risk? Based on what? Based on factors such as age of persons, sex, are they males or females, ethnicity, socioeconomic status, geographic location, or other relevant factor. Third one, where? And could it happen in any other whereabout? And could it happen at any time? So for hazard identification, we have 3 points to ask about. First is what, who, and where. After hazard identification, we go another step, which is hazard quantitative and qualitative assessment. It's the application of numerical methods. I mean, here's a quantitative assessment. It's the application of numerical methods or use of quantitative data such as air temperature, air movement, humidity, whatever the hazard, physical, chemical, or whatever. It's a measurement by numbers, by numerical methods. Whereas the qualitative assessment is usually descriptive operation, level of education, level of anxiety, stress or depression, acceptance of some service, level of cooperation. I told you before in other last webinar, all those factors or all those examples are subjective and different from person to person. Here, risks are then assigned a qualitative value based on their probability or likelihood of occurring and impact on subject. Step forward is what's the precision environmental monitoring in hazard quantitative and qualitative assessment. Precision environmental monitoring to monitor air, water quality real time, individual exposure to and identify the sources of pollutants among the really exposed persons. So it's real time monitoring among really exposed persons. We measure it at a hyper local level. Identify pollution hotspots, implement targeted intervention to reduce exposures to harmful pollution or pollutants at that hotspot. This can help to reduce the risk of respiratory and cardiovascular diseases caused by air pollution at that spot. Step forward to exposure assessment. Exposure assessment is estimating or measuring the extent of contact between a person or a population and a hazardous substance, whether physical or chemical or whatever of environmental condition. So, by exposure assessment, we have to determine the exposure pathway. Is it respiratory, skin contamination, digestive, whatever. And estimation after that, the level, the frequency, and duration of exposure. And we have to compare of the estimated exposure levels with established exposure limits, which we call it TLVs or whatever. Fourth point is the risk characterization. After we have done the exposure assessment, we have to do what's known as risk characterization by risk analysis of the hazard. Risk analysis of the hazard is studying the probability and the severity. This is the risk analysis. So the probability and severity of an adverse outcome occurring in an individual or group exposed to specific concentration of or dose of a hazardous chemical, physical, or biological agent. While risk evaluation is a process of comparing an estimated risk against given risk criteria to determine the significance of the risk. Last point is estimating total risk, which is integrating all the results of steps above, involves calculating the overall probability and potential impact of adverse outcomes by integrating all identified risks associated with a particular hazard, activity, or system. By the end, as we see that combining precision medicine with public health using big data with big analytical or modern analytical methods using the omics, social, clinical, environmental, PGHD, which is population health genomic data and demographic data. This is the precision public health. So precision public health using both precision medicine as long as public health to reach the vision of precision public health. Now, as a holistic vision, public health usually is concerned with improving the health and well-being of communities and population through prevention and control of diseases, all illnesses and other health threats. All of us know this. It involves the application of scientific knowledge and methods, the implementation of policies and interventions to promote health and prevent illnesses, while precise or precision public health is concerned about something else. Actually, it's concerned with the same concerns of public health, but it's concerned in addition with population disparities, Different populations have different health needs and priorities. We have discussed it before in many sessions. Requires a deeper understanding of the specific health challenges faced by different groups. Third, emphasizes the importance of using precise medicine with evidence-based strategies that are most likely to be effective for each particular population. So precise public health, I repeat it every now and then, precise public health approach is a more targeted and customized approach that takes into account the unique needs and characteristics of specific population. Again, precise public health approach is a more targeted and customized approach that takes into account the unique needs and characteristics of specific population. As we see, such approach usually enhances the use of data and technology to accurately identify and address health issues at the population levels. We mentioned it before. Uh, this leads to understanding the mechanistic underpinning of each health problem. Second, identify risk factors and to identify and target the high-risk subpopulations. Understanding the underlying causes of health disparities and to detect corresponding inter-individual variation in risk and response to preventive interventions. Lastly, to identify patterns and trends in disease occurrence and health outcomes. Second, it's an approach to public health using precise medicine to tailor interventions and policies to the specific needs and characteristics of individual or population. This leads to decreasing the disease burden, narrowing health disparities, and improving health outcomes for individuals and population. This approach can improve the effectiveness of public health intervention and reduce costs and minimize the risk of adverse events. Third point, maximizing the benefit to harm ratio at both the individual and population levels. Again, the precision public health approach or precise public health maximizes the benefits to harm ratio at both the individual and population level. For the benefits, the delay or prevention or early detection of problem and prolongation of a disease-free living. Definitely. The use of public health approach can delay or prevent or early detect a problem and consequently prolonging the disease-free living for each person. Second, we have mentioned around 100 times during this session, targeted interventions and personalization. Cost effectiveness, definitely, we discussed it before. Improved health outcomes, prevention of chronic diseases, early detection and intervention. The overall precision public health has the potential to improve the effectiveness, efficiency, equity of public health intervention, leading to better health outcomes for individuals and communities. What about the harms? Identification and treatments of clinically irrelevant problems. By the way, second, false positive tests that induce anxiety and result in unnecessary, sometimes invasive procedures to confirm falseness. Third, adverse events from preventive interventions and costs to the individual and the health system. Now, what are the requirements for using precision public health? First, data infrastructure and accessibility with advanced analytics and technology. For example, like high quality data, interoperability between the persons sharing this action, big data analytics, artificial intelligence, IA, and machine learning, geospatial technology, workforce development, trained person, by the way, policy and ethical frameworks for regulatory policies, ethical consideration, and public engagement, community-centric approach to assure equity, focus, behavioral insights, engagement, and education. Last one, funding, monitoring, and evaluation. Here's if we want to speak about how powerful is the precision medicine in streamlining health services. First, we have to know what's streamlining health services. I'm sure that you all know it, but again, it means improving the efficiency and effectiveness of healthcare delivery by simplifying processes, reducing waste, and optimizing resources. How does streamlining health services benefit from using precision public health? Better disease management and patient engagement, personalized prevention, reduction in healthcare costs, improved population health management, increased participation in clinical trials, improving public health surveillance, and improving population health management. And I remember that we have discussed all points or all those points before. At last, I have the gut to say that we all have enough knowledge and insight now to dive into the practical application of precision medicine and the precision public health. I'm spent with abstract ideas, and I had a premonition that it's time for us all to name names. How to address the real issues fair and square. So it's time to put up or shut up. No more much ado about nothing. Please, if you want to know how this works, stand up for your questions, and it's the discussion now. It's the discussion time now. Precision medicine is aptly named because it's the time for precise answers and actionable steps. Uh, we're going to take type 2 diabetes mellitus as an example for applicability on a practical ground of using precision public health. All of us know that type 2 diabetes is a major public health problem worldwide. Traditional public health approaches often use broad population-wide strategies to address type 2 diabetes mellitus, such as, for example, promoting healthy diets, physical activity. This approach supposes that this management is fitting all patients with type 2 diabetes. While these efforts are beneficial, they do not account for individual variability, risk factors, and behaviors a response to intervention. So precision public health applies data-driven methods and tailored intervention again and again and again. Tailored intervention to target subpopulations or individuals more effectively. So first, in first step in the practical approach to precision public health with a problem like type 2 diabetes mellitus, we have first to identify the problem. All of us know that diabetes disproportionately affects a specific subpopulation based on, we said before, according to or based on genetics, lifestyle, socioeconomic status, geographical locations. So identifying at-risk individuals or groups with high accuracy is critical here in this step to improve prevention efforts targeting each subgroup. I'm sure that you understand the problem now. Second step in such procedure is data collection. Data collection, like genomic data, genetic predisposition, like variation in any genes concerning with type 2 diabetes, behavioral data like physical activity levels and dietary habits from wearable devices or self-reports. Definitely all of us know that physical activity and dietary habits differ from person to person, that accordingly can affect the manifestation of type 2 diabetes and management of type 2 diabetes based on each person personally. Third one is social determinants of health of such persons, like access to healthy foods, healthcare services, and socioeconomic status. Geospatial data, they are the hotspots of diabetes prevalence using GIS, which is Geographic Information System. Example tool, predictive models integrating electronic health records and genomic data to identify individuals with high risk profiles. Now, based on the information we have got from the previous slides, we have to go directly to tailor the intervention design in a precision way. So the interventions are or must be tailored to the identified subgroups or individuals. For example, we found a high genetic risk group with poor diet. So what's potentially beneficial for them will be personalized nutritional counseling, dietary plans based on genetic predisposition, like for example, like low carb diets for those sensitive to carbohydrate metabolism problems may be found like sedentary lifestyle with urban setting. So what's would be fitting for such group is or subgroup is neighborhood level infrastructure changes such as creating walkable spaces and personalized fitness programs using mobile apps. Another group, low socioeconomic status with limited healthcare access, community-based interventions such as free screening programs, access to affordable diabetes prevention medication like metformin, for example. So now we have seen here that we tailored each intervention specifically for each group. The fourth step is implementation using technology, such as mobile apps like delivering targeted messages for a specific subpopulation, targeted messages or reminders or personalized recommendations based on user data. We can use wearable devices like monitoring physical activity and glucose levels in real time, like enabling dynamic adjustments to interventions. We can use AI-powered analytics, continuously updating risk scores based on new data inputs. Example program here is the diabetes prevention program modified for precision by integrating real-time data from wearables and individual risk profiles. Actually, I started to feel I'm exhausted a little bit. The fifth point is monitoring and evaluation. Otherwise, all of our previous actions and approaches go in vain. So we have to do regular monitoring and evaluation, regularly assess the program's impact on blood sugar level, weight loss, and physical activity. Use advanced analytics to refine interventions every now and then. Based on what? Based on ongoing outcomes. Friends, start breathing freely now. It is the end. Thank you all for your time and attention throughout this presentation. I truly appreciate your patience and the care with which you followed along. It has been a privilege. Actually, it has been a privilege to share this information with you, and I sincerely hope that the insights shared today may provide you with valuable takeaways. The journey of learning and exploring these topics together is what truly makes this discussion meaningful. Actually, yes, I encourage you to reflect on the points we have covered and discussed and apply them in your work or daily lives. Once again, thank you for being such attentive audience, and I look forward to any further questions or thoughts you may have. By the end, have a wonderful day ahead. Thank you all, thank you all, thank you all.